Minutes. Okay, so we are live on Facebook, Instagram. Thank you for joining me. My name is Nicole Nifo. I'm a registered massage therapist with 15 years experience in the industry, working with patients, teaching. I've become very passionate about working with new moms during their pregnancy and also in postpartum, especially those who go through cesarean delivery. I myself have one child via cesarean, emergency cesarean, 5.5 years ago, and we are currently expecting our second child in 8 weeks via planned cesarean. So I wanted to talk to you about some of the things that have come up for me personally, but also things that have come up in my practice, things I see in some of the Facebook groups online. I'm in some groups that are like for C-section moms, and it's like 15,000 people. So I'm seeing a lot of commonalities. So this is why some of the topics I'm doing with our Facebook Live are really important, because although maybe you yourself don't have kids or you've never had a cesarean, you've had vaginal deliveries, I think it's still important to understand what it is that those of us who do have cesareans go through emotionally and also physically. So we can just have a better understanding of each other. Again, like I said in our last Facebook Live, there is so much information out there regarding childbirth via vaginal delivery. There's very little as far as preparation, support, and postpartum recovery for cesarean. So this is why I'm doing this. I've become very passionate in doing this because I felt like part of helping others has helped me heal in my own journey. So with that being said, I would love to start our topic. So our topic today is talking about triggering words. So if any of you are tuning in, watching this, I apologize that we're so late in the day. It's already 6 o'clock, which is dinner time. It was just such a busy day today. So if you are watching this as a repeat, please comment. I will respond later. Feel free to send me a message as well with any questions. Whether you're a new mom via cesarean, you have a friend who had a cesarean or relative and you want to support them, or if you're 30 years post-cesarean, I have lots of information to share, and ask away. Nothing is crazy. I just want to hear it all. So what we're talking about is triggering words. I'm really trying to change the way that we look at cesarean deliveries. As it was brought up in our last Facebook Live, and it was the words we're using. And so this is something that I've become very passionate about, because you have to remember that a cesarean is a major abdominal surgery. It's not just, someone's giving birth. It is giving birth for sure, but it's also major abdominal surgery. And historically, it's not something that is usually just given unless it's medically necessary. Nowadays, people are electing for cesareans, but I still think, mental health can play a part in why they're choosing to elect for a cesarean. There's definitely fear. Maybe they're prone to postpartum depression, and they think that, maybe going through cesarean will be easier for them. Whatever the reason is, people are choosing cesareans. People are having cesareans because of an emergency situation or planned because of a medical reason. So it's not something that is really easy to recover from. It does take lots of time. And unfortunately, because of the lack of information out there, a lot of people who have cesarean deliveries are kind of just filtered through with the patients who deliver vaginally. And let me just also say, vaginal delivery in general is not easy. I know that. I went through 40 hours of labor myself, so I get it from that perspective. But I think that we need to be a little bit more aware of the words that we're choosing to use when we're talking about people who are delivering via cesarean. So let's just talk about the two obvious ones. So you hear me saying cesarean a lot today. Hi, Daniela. So I'm saying cesarean a lot because cesarean is something that I am doing to give birth to my child. That is how I'm bringing life into the world. It is via cesarean. And whenever I talk about C-section, I'm actually talking about the surgery, right? So It's a C-section. It's an easy way to say what the actual surgery is, that specific type of abdominal surgery for birth. And that's more when I'm talking medical terms. When I talk about my childbirth experience or preparing for my childbirth, I tend to use the word cesarean. There's other words out there like belly birth. I think someone was mentioning something else. I can't remember. It was like roof birth, or I don't know. Anyways, she'll probably comment later what it was, but belly birth is a new one that I've been hearing a lot of, because we're trying to take away the lack of emotion that C-section sounds like when people are talking about their deliveries. And any of you who've given birth or who are mothers, even if you didn't give birth, you understand that it is such an emotional thing to have that connection with your child, with your baby, whether you had a surrogate or was adopted, or you carried that baby inside of you and you brought them into life. It's emotional. And so when we just pass it off by saying C-section, people tend to lose that connection to the fact that they gave birth to a child. Your body did so much to, get that baby ready to come to this world. And when we just say C-section, it really takes away the value of that. So another thing that I found really important that actually bothered me a lot was when people would say, you tell people a little bit about your birth story. Some might say, oh, when's the baby coming, or how did your last birth go, or, whoever you're talking to, whether it's medical professionals or on a personal level. And you tell them a little bit about your birth, and mine so happens to have had some trauma in there during our cesarean. And you get a lot of the, well, at least you and the baby are healthy and okay. And that, I think, because people don't know what to say when they know that you've experienced something that you didn't want. For myself, I wanted to have the home birth in the water, had the birthing tub all set up, and that was my plan. But unfortunately, we can't control childbirth. It's not something that, we're going to tell ourselves in our brain, like, this is what we're doing. You can prepare for it, but really at the end of the day, it's something that's out of our control. We don't know if the size of our baby's head is going to fit into our pelvis. We don't know if a medical emergency comes arise and the baby's heartbeat's dropping. And, so you can do as much as you can to prepare, but at the end of the day, it's really just up to your body and what is meant to be. So when we're saying, at least you and the baby are okay, it kind of starts to take away that emotion of the fact that you did go through a lot. And, I'm sorry to hear that you had to go through a lot. And I'm really happy to hear that you and the baby are okay. That may have been a nicer way to kind of not take away the power of how hard the situation was. When people just say, at least you guys are healthy and okay. It's like, what new parent doesn't want to be okay and have their baby be healthy postpartum? It doesn't matter how they came into this world, because anyone who's given birth to a baby who's sick or needs emergency help, or that they're not okay postpartum, it's even harder, right? So of course you're thankful. Of course they're thankful that they're okay. But really, there's a way to say it in a way that doesn't take away the emotion and power of what they went through. And that's just by acknowledging the fact that maybe they did have a rough time, or acknowledging the fact that they did go through something difficult, and maybe even just not saying anything and just listening. Just listen to their birth story. Not everybody wants your opinion. Not everybody wants you to share your birth story. Sometimes they just want someone to listen. And I think that's really important. We kind of lose that sometimes, is we forget to just listen to people. Another one that's come up a lot with teaching, and also just being in the perinatal world that I work in as a massage therapist, is natural. That word natural is a very triggering word for people, because when you're saying natural, what does that mean? Natural is a word that, these big companies have put on top of their products to basically sell you into buying something that you think is organic or from the earth. Well, if you're looking at natural pregnancy, it is natural. You're growing a baby inside of you. That seems like nature, doesn't it? It doesn't matter how it got there. At the end of the day, it's nature happening. And we're talking about natural as far as giving birth. One person might say natural is giving birth via vaginal delivery instead of cesarean. Another person's natural is not using any medication as opposed to getting an epidural. Another person's natural is, I don't know, I can't think of it right now, I'm getting pregnancy brain, but regardless, what I'm saying is natural is a triggering word because it can mean so much. So instead of saying, oh, did you have a natural delivery, or I had my baby naturally, what does that mean? Be more specific, because nowadays, 1 in every 3 of us is having a cesarean. And if you're in a group of 3 or 6 people, you know, you have at least 1 to 2 people out of that group of 6 or 3 that gave birth via cesarean. So when you're telling them natural, what does that mean? So I started looking at it as like, I'm giving birth in my planned cesarean in 8 weeks. And that is my natural way of delivering my baby, because that's nature. My only nature and my only natural way is to give birth via cesarean. I cannot give birth via vaginal delivery. So really think about the words that you're using as far as as far as childbirth when you're saying natural. Another one to talk about is even medicated or non-medicated. I mean, at the end of the day, who cares? You know, you do what's right for you. If having medication during your birth is what got you through it, then do it. If you want to try doing it without, then arm yourself with a doula and a midwife and all the tools to kind of get you to that point. But I mean, if something happens, you end up needing a cesarean, I mean, at the end of the day, it's out of your control. And I think the most important thing is that we all feel, hi Ellen, we all feel good about our birth experiences, no matter how it happened. We have to come to terms with the way that we've delivered our babies into this world. And I mean, there's, I'm sure, a small amount of you that are just like, you know what, whatever. I gave birth to my child. I'm more worried about how I'm going to raise them. Or, you know, I would rather that I had a cesarean than vaginal delivery, or vice versa. So everyone's going to have an opinion about what's best for them and what they care about. There's a hierarchy of lists on your list of things that are important to you. And, you know, childbirth is an important thing for a lot of people because there's more information out there now and there's more tools that we can use to help get us through it. You know, they're not just putting women under general anesthesia anymore. And then when they wake up saying, oh, by the way, you had a baby, right? So there's actually a process to it. Even with cesareans nowadays, there's a whole process. There's a way to feel empowered in your birth. So when we're talking about even vaginal delivery or cesarean, think about the words that we're choosing to use, because sometimes if I'm talking about my natural birth, it might offend somebody who had a medicated delivery that they didn't want to have. And they plan to not take medication. They plan to not take that epidural. But unfortunately, for so many reasons, we don't need to go through them right now, they needed to take the medication to get them to that next level to eventually birth their baby. And same, if that person who wanted that vaginal delivery ended up in a cesarean and it wasn't their ideal circumstance, they need to find closure. And when we're talking to people and we're sharing our experiences and we're trying to connect to people and find likeness with each other, and people are just, you know, throwing these statements out there like, well, at least you guys are healthy, or, you know, putting on a pedestal that they had a natural delivery, it can make other people feel like crap. And that's all I wanted to say. You know, I think it's really important to just highlight these things. What are some of your experiences? Have you had a cesarean? Did you feel like your body failed you? That was something I hear a lot. Do you feel like, you know what, it was meant to be and it's fine? Has anyone made you feel bad about it? I've seen lots of stuff on some of the groups where people are made to feel bad about delivering via cesarean. And I'm like, what? Like, you had to, like, medically you had to, you had no choice. If you didn't, you'd be dead. And your baby probably would be too. Like, that cesarean probably saved your life. Why would you have to feel bad about it? Do you know what I mean? Like, it's not something that people get to choose. And sure, if people get to go for a VBAC, which is a vaginal birth after cesarean, and they're waiting over 2 years, then they're eligible. But at the same time, some aren't. I'm not, unfortunately. I have to always have cesareans if I'm going to give birth because of what happened during my last one. But even if people are choosing to not do that and they just go right to the cesarean because that's what they know, that's what they're comfortable with, that's what they're used to, they know what to expect, why is there judgment with that? There really shouldn't be. And I think we really need to change the way we're looking at birth. And I'm not here to promote cesarean deliveries at all. I'm not here to promote birth surgery. I think that it's something that's medically necessary, but I think that we need to have more heart when we're talking about it to people, because a lot of those childbirth education courses in the hospitals, privately, they're not covering cesareans. And if you do, amazing. I'm so happy that you cover that in your courses. But a lot of people are not covering this topic. And if 1 in every 3 is having a cesarean, you are not helping that person, that 1 person out of 3, prepare for something that is going to change their life, because they're being cut, as I showed you in the last week, they're being cut through multiple layers of tissue and organs to be able to get to that little baby, okay? That's what I was showing you last week. And that scar doesn't go away. It fades, it shrinks, but it can leave a lot of damage and cause a lot of problems later in life. So if you're not preparing them for surgery, you don't have to promote it, but you need to talk about it because it's real. People may not plan for it, but it happens. That's why it's called an emergency. And so even when you look at postpartum rehabilitation programs, people are lost. There's no information out there. Everyone talks about cesarean or vaginal deliveries. This is how you heal your perineum after giving birth. Well, you know what? Some people who've had an emergency did push for 4 hours. So yeah, they're going to have pelvic health issues, and that needs to be brought up. That needs to be talked about. And this stuff is not being talked about because we're afraid to talk about cesareans. We're afraid to talk about them because we don't want to promote them. Well, guess what? We're not promoting them. We're just empowering. So if we change the angle that we're looking at birth surgery, then we're going to help so many more people. Whether you're a practitioner, whether you're a friend of a mom who's had cesarean, whether you're a mother of a child who's had a cesarean, or a sister, or a partner, if you're the husband or wife of a woman who's had a cesarean, this type of information is needed. It needs to be shared and talked about. And some people just need more compassion and patience when it comes to healing from cesarean delivery. And they're not going to heal the same way someone who had vaginal delivery heals. It's going to take a little bit longer. And if they've had an emergency, chances are they may have had trauma. And this is the stuff that needs to be talked about. So anyways, share your experiences, ask questions. You can privately message me if you don't want to post it here. I love talking about this stuff. I'm going to be on every week talking about everything cesarean, either preparing or recovering. I'm sorry I was a little ranty today, but I'm definitely very passionate about this subject. And when my patients come in post-cesarean and we talk about things, it's very common. And the commonalities are that there's no support, there's no information, and women are just left with nothing to help them heal their bodies and minds. And I think it's important if there's more of us out there advocating for them. So on that note, I hope you all have a great evening. Enjoy your dinners, and I will be back next Tuesday, hopefully more in the afternoon and not so late. And I will be posting the topic over the weekend. If you have any suggestions of topics you want me to talk about, please message me and I will definitely address that. And if you're a professional who works with people who've had cesareans, or is passionate about the topic, or experienced one yourself and you'd love to collaborate, please message me. I can definitely do like a interview Facebook Live with you one week. I just want to get more information out there, help empower more people with the tools that they need. Okay, so adios. Good night, everyone.